The tips in taking patients' history questions. This is useful for OSCE and CELBAN. Number 1, introduce yourself. For example, hello, my name is She. I am a registered nurse and I will be your nurse today. Number 2, establish who the patient is and to be sure that you have a correct chart for the correct patient. First, you have to check the ID band and you can ask the patient, what's your name? How do you spell your name? Can I ask you your date of birth? So, date of birth is more specific to identification than age is. Number 3, explain what you're going to do and why are you going to do it. So, example, I am going to ask you some questions to get more information so that we will be better able to help you. Is that okay with you? So, when asking for facts, it is acceptable to use closed questions. Do you, when, how many? However, if you are asking about something fairly personal or sensitive, it is necessary to use a polite question form such as, can I ask? Could you tell me? Would you mind telling me? Number 4, explain who will have the access to this information and why they will have an access. The information that you will give to me will only be shared with the members of the healthcare team that are involved with your care. This is so we can make a comprehensive plan for your care. So, not all information is shared with all the team members. So, just only to need to know basis. Number 5, entrance complaint. This is the reason for the visit, so this is where we start. The interview should start with open-ended questions to give the patient a chance to point out their concerns and give the background of the complaint from their perspective. For example, what has brought you here today? What seems to be the problem? What can I do for you? How can I help? You have to become empathetic to the resident, and you have to also to use open-ended questions. So, it is best to follow the patient's lead and allow them to explain their complaint in a sequence that makes them sense to them. In this way, it shows the patients that you are listening to them rather than gathering information for your own purpose. If the patient misses information that you need, you can ask for the specific information about they have told their story. If you need more details about what they're telling you, you can ask more probing questions. Number 6, so for example, can you tell me what you do in an average day? So you can ask these some questions and about location, duration, type, severity, relieving or aggravating factors or precipitating factors. It depends on how you can lead it. For example, for the location, where does it hurt? Where it's sore? Or you can also say, does it radiate anywhere? Does it stay in one place or does it go anywhere else? And about duration, you can ask, when did it start? How long does it last? For a question about type, can you describe the pain? Is it sharp, dull, stabbing? Is it continuous, that is come and go? You have to ask or give a hint to the patient so that they will know what kind of pain they are having. So questions about severity, you could ask about how rate it is, the pain is, 1 being the lowest and 10 being the highest. You can also ask, is it bad enough to wake you up or does it affect your work? Asking how the pain affects the patient's everyday life can help to put the pain into patient's context. Question about relieving or aggravating factors, you can ask, is there anything that make it worse or better? Question about precipitating factors, what brings it on? Does it come on a particular time? Have you taken any medication for it? Did it help? Have you done anything else to help your pain? Did it help? So asking the patient's opinion, you can ask, how do you think you got this problem? What do you think the cause of this problem? Number 7, so to wrap up, this is the point where you can summarize what the patient has told you to be sure that your information is correct and that you have not missed anything. This is also the time to ask about any other concerns and allow the patient to ask more any questions. Apart from your problem, are there any problems? Do you have any other concerns? Do you have any other questions? So number 8, plan. You have to plan. This is where the nurse tells the patient what are the next steps are you helping the patient. For example, I will now do a physical exam. The doctor will see you now. So here are the tips in asking patient's history questions. I hope you subscribe and like my channel. Thank you and have a great day to everyone.